This video is going to cover all aspects of data collection around disabling condition, health insurance, and non-cash benefit sources within assessments in HMIS. It's important to note that there's two sections to each of these data points. One is a yes/no question, and the second is a HUD verification subassessment. When answering the questions around disabling condition and health insurance information, it's important to know that it has to be answered for all members of the household, including children under the age of 18. So for disabling condition, it's really a client's report of what if they have a disabling condition, and if so, what type of disabling condition do they have? So the first question that you're going to answer is, does this client have a disabling condition? Yes or no? The next, you'll see this subassessment that has a HUD verification word and then a red triangle next to it. The easiest way to fill out this information is to click on the word HUD verification. You'll get another record set that opens up that has the list of all disabling conditions that we track within HMIS. You must answer yes or no to each one of these disabling condition types. The easiest way to do this at once is to click no at the top, and it'll answer no for all of these disability types. And then if a client does identify as having a disabling condition, you just simply click yes for that specific disability. Once you click yes, you will have another record set that's going to ask a few extra questions. One is, if yes, is it expected to be of long continued and indefinite duration that substantially impairs their ability to live independently? You would answer this question to be yes for a couple reasons. One, they have a documented disability, or second, they do think that it is going to impact their ability to live independently. So the client identifies that yes, it will. This is really helping the system to identify who is chronically homeless with a disabling condition and long stays and times of homelessness. The start date will auto-populate with the same as your entry date, or if you're adding an interim assessment or an exit, it'll also pre-populate with the date of that assessment. It's not necessary to change this date to the actual start of their disabling condition. All start dates and end dates are really associated with the entry time of the person's you're serving the person in your project. So the start date's just going to say on this date, it's just saying on this date, the person identified as having a disabling condition of this type. There is a note section here. It's important to not put any health-related information like the actual mental health diagnosis or a physical diagnosis or a medical condition. You do not have to put and should never put the specific diagnostic information or medication associated with that. You'll notice this next question is retired from the system, which means you don't have to answer this question. There are end dates to all of these record sets, and the end date is really there within disabling condition to say maybe the person said they had a disabling condition, but then later you obtained medical proof and documentation that they didn't have this disabling condition, and you can put an end date. End dates for these data sets are always the day before the assessment date that you're doing. So once you identify the disabling condition and answer these questions, you're going to save it. Now you can see that it's logged and that the person has a mental health disorder. And then all of these questions are answered yes or no, and you can save and exit. When you do this, you can note through this subassessment now there's a check mark next to the HUD verification where there once was a red triangle. This means that this data set is complete. The next subassessment area we're going to cover is health insurance information. Again, this has to be answered for every person in the household, even those children under the age of 18. So you're going to say, are they covered by health insurance, yes or no? Then you're going to go to the subassessment, click on the word HUD verification to pull up the subassessment. You'll notice there's a lot of choices for medical insurance types within the system. You're going to choose one. If a person identifies as having one, you're going to choose the one that best represents their health insurance type. Again, just like with disabilities, to make it easier, you can check no for all of them and then just simply move and check the yes for the medical insurance that the person identifies having. And then you're going to save and exit. And again, you'll see that through the health insurance, their HUD verification, you do have a green check mark. So to end a health insurance record, so you'll see that I marked as this Medicaid, that yes, they had Medicaid. If for some reason the medical insurance switches and you need to answer a new and add a new medical insurance or health insurance that they have, click on the pencil next to that Medicaid. And then you'll notice if you go down here, there is an end date. So if you add an end date, it's always going to be the day before the assessment date, and then you'll save. You can also save and add another if the client identifies as having a different health insurance type. So if you save and add another, you'll bring up a new sub-assessment record set. You can add the new health insurance for that person and then save. Non-cash benefits is a question that has to be answered for the head of household and any adult over the age of 18 that lives within the household. So again, you'll answer, do they have non-cash benefits of any source? Yes or no. And then you'll go and finish the HUD verification sub-assessment. You'll notice all the non-cash benefit types, including SNAP or food stamps, WIC, TANF services. There's 3 different types. To make it easier, again, click no, and I'll answer no for all of them, and then just simply move the no to the yes for the specific non-cash benefit that the client identifies as having, save and exit. Again, just like medical insurance, you can end a non-cash benefit source. So if a person says they no longer have SNAP benefits, you can open that up using the pencil. So if you click on the pencil, it'll open it up. You can add an end date, save. If they still have SNAP and they added a new non-cash benefits, you can just simply click add. You can select the source of those benefits. If there is a cash amount or an amount of money, you can add that. It's not required. They are receiving the benefits and the start date and save. And that concludes this section of the training.